Hi, everyone. Welcome to Heart of the Matter. I'm your host, Elizabeth Vargas, and I'm here with your friendly reminder in the holiday season to be kind to yourself. This is a tough time for a lot of people. It's important to make sure you're taking good care of yourself. We know, for example, that we also have the pandemic that we're dealing with, and according to the CDC, 80 million Americans are experiencing mental health stress because of the pandemic. In fact, the CDC also says in the first 3 months of 2020, drug overdose deaths were up 10%, which is pretty scary. There's also been a surge of opioid overdoses. In the Journal of the American Medical Association, they reported an increase in Virginia of 123%. So people are really struggling in this time. And it's a great time because of those frightening statistics and the challenges of the pandemic and the holiday season to talk to our guest today on Heart of the Matter, Beth Macy. Beth wrote an incredible, stunning book called Dopesick. It came out 2 years ago. It's about to be made into a television series on Hulu. It's about the opioid crisis and the role of Purdue Pharma, which aggressively marketed Oxycontin. The Sackler family, which owns Purdue Pharma, made $13 billion off of that drug. And of course, we know Purdue Pharma recently pleaded guilty to 3 criminal charges for defrauding the U.S. government about the addictive nature of Oxycontin and for paying illegal kickbacks to doctors to prescribe it. The Sacklers themselves have so far evaded criminal charges, even though they've been dubbed the first family of pain in a really remarkable cover story in the New Yorker magazine. And Beth Macy, in her book Dopesick, really delves into how this crisis caused by the widespread prescription of this drug has affected communities up and down the East Coast. It's a remarkable, remarkable book. And she has some tough words for the outgoing Trump administration. We obviously, in our last episode, interviewed Jim Carroll, who was the Trump drug czar, about what he thinks they did right and what he thinks they could have done better in his time serving in the Trump administration as drug czar. Beth Macy has some tough criticism. So I'm really excited to have a conversation with Beth about her book, about the opioid crisis, and about the state of recovery in our country. Beth is an incredible storyteller and intrepid reporter, and I welcome her to Heart of the Matter. Good to see you, Beth.
Thank you so much, Elizabeth. It's wonderful to get to talk to you.
Well, I read your book, Dopesick, and, it blew me away, and parts of it made me cry, the stories of these families and their kids, mostly, lost to this epidemic of opioids.
Yeah, parts of it made me cry, too. There were days where I thought, I can't do this. Honestly, I don't know if your listeners know, but when you get paid to write a nonfiction book, they pay you a third up front and then you get the other 2 parts later. Mm-hmm. And there was a moment early on where I said to my husband, I don't think I can finish this. I think we're going to have to give the money back. And he's like, we've been living on that money. So the only way through it was kind of through it. And, there were some weeks where I would interview somebody, and by the time I got home and was typing up my interview notes, that person had taken their life or overdosed. I mean, it was just a hard story. And yet, if you're not looking at it, it's a very easy story for most Americans to miss.
Well, that's the theme, really, of your work that you've done reporting on this, both in the book and since then. You've continued to write about this. Is that this is something that we missed. For years, it was slowly growing, metastasizing, spreading through rural communities in Appalachia, in Virginia, and nobody was paying attention to it. You call Oxycontin the nuclear bomb of opioids, and yet nobody was watching.
Exactly. And then once those prescription pills got harder to get, call it 2010 to 12, you and I may not have known that Oxycontin and heroin were chemical cousins, but the drug cartels certainly did. And so they started bringing in heroin and later fentanyl, laced heroin, and now just plain fentanyl, because they're business people. They're smart business people who know that one's fear of withdrawal or of becoming dope sick is a really great business model, and that people would simply keep using that drug because they didn't want to be so sick.
I was struck by something from the middle of the book when you were interviewing somebody who had gotten hooked on Oxycontin and later on heroin. And he said, quote, "It was like shooting Jesus up in your arm," Brian said of his first IV injection. "It's like this white explosion of light in your head. You're floating on a cloud. You don't yet know that the first time is the best. After that, you're just chasing that first high."
Yeah, when he said that, I mean, I got goosebumps just now hearing you read that. I've never shot up heroin or done oxy, but when he described that so viscerally, I could feel it. And then what he would have said immediately thereafter was that in the end, you're not doing it to get high anymore. You're just doing it not to be really, really, really sick. So, and then that was the thing I wanted to really underscore, that a lot of these folks were initially addicted through no fault of their own. Drug companies put this scourge on America, and many people, not all, certainly not all, but many people became addicted because there was this surplus in America's medicine cabinets. And so if they weren't prescribed directly, like young Tess Henry that I write about in the book was, and eventually goes the route of those we've just been discussing, others like Brian, who you just read from, got it from stealing excess opioids from his parents, grandparents' medicine cabinets. Brian even took a job at a senior moving company with the express purpose of stealing their meds as he was packing their stuff up to move into retirement.
So let's go back to the beginning when Purdue Pharma began marketing Oxycontin. They came on the market with this very powerful painkiller, promising that it was, because it was time released, that the danger of addiction was literally, quote, less than 1%.
Yeah. And the FDA let them make that statement, but the FDA didn't require rigorous studies.
What is that 1% based on? I mean, is that Purdue Pharma's own research? I mean, where did they come up with this less than 1% addiction rate?
Well, if you peel back all the layers of the onion, that claim came from a 1980. Now remember, Oxy came out in 96. So a 16-year-old letter to the editor of the New England Journal of Medicine. And it was literally, I think it was 4 sentences long, this letter. And it wasn't a study performed among outpatient. It was a very small sample of inpatient only. So not in the way that Oxy got prescribed in outpatient settings largely. And so they found this one little minuscule, almost a footnote, if you will, claim, and they kept repeating it. And then they hired kind of experts in their field to repeat it. And it was on the cover of Time magazine at one point. It was trumpeted right and left. And yet when you looked for it, and this is something that's going to be in the Hulu show, it took a lot of sleuthing to figure out that it wasn't a real report at all. It was just, I say in the book, it's like a bad game of telephone gone terribly awry. The meaning was totally switched around, and the author of that report had no idea it was happening until I think Sam Canones, the journalist, called in and said, "Hey, did you know this was happening?" And, he was flabbergasted. And so yet, because it was a media failure too, because people weren't fact checking it.
They were just repeating this claim that it turned out to be baseless. Because there's been
Absolutely.
reporting, and tell me if this is true or not. There's reporting that Oxycontin is actually, there's an addiction rate of 56%, not less than 1%. Is that accurate?
Yeah, much higher than 1%. The numbers change depending on which source you're looking at. But yeah, we know it's much higher. And the people out in the coal fields and in rural Maine and Cincinnati and these hot spots, which tended to be places where there were high incidents of workplace injuries, logging, fishermen, coal miners, furniture makers. The company targeted those regions because they purchased the data from something called IMS Health, which told them which doctors and which communities were already prescribing the highest rates of competing opioids like Percocet, Vicodin, Loratab. And not to geek out on you with this, but I mean, it was the DEA didn't have this data, but Purdue had it because they bought it. And so then they could hire an army of sales reps and send them everywhere, but send them largely or with the most rigor to places where they knew there were already people hooked to competing opioids, with the message that, look, that the FDA allows us to say that our drug, as compared to these immediate release competitors, is safe. And it was just so wrong, no matter how you look at it.
So the sales reps go out, armed with this research, to communities where they already know they're prescribing a lot of painkillers. The sales reps arrive in these communities and in these doctors' offices, giving out certificates for free manicure pedicures to the receptionists, taking doctors out to lunch, wining and dining them, buying them Christmas trees, buying them dinner, sending them, on vacations to, the amount of effort put in to woo these doctors into writing lots and lots of Oxycontin prescriptions instead of Percocet and Loratab. Don't do that. Do these, is absolutely incredible.
It's incredible. And they spent a ton doing it. They really beefed up their marketing and sales operations, spent a fortune doing it. But guess what? They made a much larger fortune for having done it. They paid 5,000 doctors, nurses, and pharmacists to go on these cushy resort vacations, which were technically CMEs, medical recertification points, where they would learn more about Oxycontin and take it back to the communities to tell their colleagues. And many of them went on to become paid speakers for the company.
In addition, these sales reps for Oxycontin were given huge bonuses if they convinced doctors to write more prescriptions. The whole system was incentivized to sell.
Exactly. And if you talk to a doctor from, say, most of his patients were prescribing 20s, but if you got him saying, I think they do better with 40s, then your bonus would increase. So it went up it went up in approximation to how much more of the morphine equivalent was in that pill. So the higher the milligrams, the more money. And it was possible. One former rep told me it was possible to make up to $250,000 in bonus alone per quarter.
Just by getting these doctors to up the prescriptions.
Especially if you had a pill mill, you had, which were, I never saw one up close, but apparently, especially some of the early ones in Florida and elsewhere were really just a crazy, they would be co-located in Florida in some strip mall. The doctor would barely even see them. And then the pharmacy would be attached. So you could literally, people from West Virginia and Western Virginia, where I live, would rent buses, addicted people, and they would drive down, have their appointments, pay their cash only, $100, whatever it was, come back with a big old prescription of Oxy. They'd take half and they'd sell the rest.
We know that early on, doctors began sounding the alarm in these communities, saying, whoa, this is actually very addictive. I'm having patients that I helped deliver, these kids, these teenagers, these young adults, who are dying of this. There's a huge problem, red alarm, red alarm, red alert. Nobody listened to them.
No. And some of them, the one I write about the most is Dr. Art Van Zee from rural Western Virginia, and he runs a federally qualified health center, a sliding scale practice. He's just like the epitome of the old country doctor. And they just blew him up. He testified at Congress. He testified at the FDA. He called Purdue. He was among the first doctors to call Purdue in the early 2000s and say, look, I know it says on your insert that this drug is non-addictive, but I've got kids I immunized as babies overdosing in the high school library. I've got farmers, miners, people I've treated for years that had been able to take lower dose competing opioids like Loratab or Percocet for an injury and be okay, and now they're losing everything.
We know from internal emails at Purdue Pharma that they knew for years that Oxycontin was highly addictive and kept pushing that. How early on do you think they knew? Like, did they know from the very start? Did they know after the drug was on the market for 5 or 10 years? How early on did they know this was a problem and yet kept it suppressed?
Well, it became like a national story when the New York Times covered, it was called Operation Oxyfest in Eastern Kentucky. There was this big swoop, I believe it was February of 2001, big national story. Around that same time, the Attorney General of Maine sent out a letter to every physician in Maine saying we're seeing street crime and addiction-related crime at a level we've never before seen. And so Purdue claimed for years that that was the first they knew of it in 2001. But Dr. Van Zee had been writing them and calling them around the same time. And we know now from these internal emails that they did know. In fact, they sent a secretary, Howard Udell, the lead counsel, sent his secretary in chat rooms as early as 98 and 99. So she was reading in these chat rooms where drug users would describe how they could get around the time release mechanisms.
So why is it that if they knew so early and doctors were sounding the alarm so early, that you're talking about people saying, whoa, we have a major problem here. In 2001, in 2000, in 1999, it is 2020, Beth, and this is still a problem.
Absolutely. Well, there's a lot of reasons. Our government regulators failed us. They should have never allowed it for moderate pain to begin with. They should have taken it off the market like Dr. Van Zee asked them. In one of his first letters, he predicted that this was going to be the canary in the coal fields, that it was much like the early years of HIV in San Francisco and New York. And he said, I fear we're going to have an epidemic if we don't get our hands around this. Please take it off the market so it can be reformulated to be resistant to abuse. And the company didn't do that until 2010. So that's why I say around that time, the DEA did step up efforts. The drug became harder to abuse. But by that time, so many people were hooked. It was like the horse was already out of the barn. So the cartels and whatnot could step in to pick it up.
So today, how readily available is Oxycontin?
Oh, I think they have cracked down on it a lot. The CDC guidelines that came out, I think in 2016, really tried to take a look at the serious issue of this having been an iatrogenic or doctor-caused epidemic. And they tried to say that, put more stipulations on who could take it and for how long, which was good. The bad part about that is you already had so many Americans, millions of Americans addicted, that it did nothing for those who are suffering addiction, who are then going to go to the black market if you cut off their safe supply, right? So we know from data that many of them went to the black market. And at that point, you're not just getting heroin to keep you from getting dope sick. Now we know that fentanyl is in the supply. And that's what people are mostly dying of now, is fentanyl.
One of the things that is frustrating in reading not only your book, but in other reporters' stories about this incredible crisis is the lack of funding for, addiction, full stop, but especially the opioid crisis, because we're going to talk about this in a second, but treating people who are addicted to opioids is different from treating people who are addicted to other drugs or even alcohol. And yet, Purdue Pharma made an estimated $13 billion off of Oxycontin?
Yeah, one family, the Sackler family.
The Sackler family, which has been allowed in this. What is your opinion of this recent settlement with the Sacklers and Purdue Pharma?
This recent settlement is nothing but a bogus headline. It was all engineered to come out before the election to give Barr's DOJ, Trump's DOJ, like a winning headline. But we know the Sacklers are only going to pay, I think it's $225 million from it.
That's
out of the $13 billion, and then that other almost $8 billion that's left, that's all tied up in bankruptcy. So that still has to go through the bankruptcy court, and they haven't even finished deposing all the Sacklers yet. That's all still in progress. The Sacklers have offered $3 billion cash, and for a total of 10 to 12, but that's counting future Oxycontin sales and other anti-addiction drugs that they might sell. And, it's supposed to be given over to a public trust company. And the parents are just really angry. The parents of the dead and the activists are very angry that, the government should not be in the business of selling Oxycontin, and that this money shouldn't be funded by future Oxycontin sales. And just like more than that, why do billionaires get away with breaking the law? If you or I had gotten in trouble, or our company, it's only Sackler-owned company, if we had been found guilty in 2007, and then this recent charge from the DOJ that they pled to, same exact kind of stuff, kickbacks to doctors, lying to regulators, wouldn't we be in jail? I think we would. And
it's unbelievable. It's
like a different set of rules.
That this family, through this drug company, could unleash this epidemic that has killed so many people, is allowed to go live with their riches, forfeit a tiny fraction of them, not serve any prison time. It's astounding.
It's astonishing. And it's said that criminal charges can still be brought against them, but most of the people I talk to think that's not going to happen, that they're going to probably offer a little bit more and they're going to get immunity. Now, whether or not the judge can actually grant the Sacklers immunity if they pay this extra cash beyond what they've already offered, that's a subject for legal debate. And whether Maura Healey in Massachusetts, she's a feisty AG and a former point guard, whether she's going to go after them afterwards. She says she's not giving up. And I know a lot of the parents I know are really holding on to that. They want to see justice. But last week, they were in tears.
We keep hearing that in this pandemic, these, that anxiety and depression are off the charts, that substance abuse is escalating in a dramatic way because people are isolated and anxious and worried and frightened. What are you hearing about how this is affecting the opioid crisis?
Yeah, I'm hearing a lot of people in long-term recovery have relapsed. Some of them have died. I'm hearing people are dying of alcohol poisoning, including some people in long-term recovery. I am close with an addiction doctor in Tennessee who's helped me understand a lot of this. He himself was once addicted to Oxycontin, and he's now an MAT doctor. He's a Suboxone subscriber. And so he said at the beginning he was really excited because there were so many barriers put up for people on MAT. They had to go once a week. They had to pass.
Stop and explain what MAT is. What's MAT?
Sure. MAT stands for medication-assisted treatment, and it's basically a maintenance medication like buprenorphine or methadone. And what it does is it quells that opioid craving so that your brain can start to recover again. Some people think it's like insulin. You might need to be on it for the rest of your life, like a diabetic would need to be on insulin. And so, but there are a lot of regulations around it. Like a doctor has to get a certain waiver. So we know that only 5 to 8% of physicians even bother to do that because they don't want those people in their waiting rooms. So there are too many regulations. There aren't enough doctors who do it. And then there's these kind of rigid rules around urine screens and stuff like that. So what Dr. Steve told me, Dr. Steve Lloyd, he used to be the drug czar in Tennessee, and he runs several MAT clinics now. He's like, thank goodness that SAMHSA reduced some of those guidelines, and so they could now induct people on buprenorphine, MAT, over the telephone, and then he would catch up with them once a week. And he said it's working really great at the beginning. But some people relapse when they got their stimulus checks because they had never had that much money all at once before, that plus stress. But he said, as he was meeting with his patients, some of whom he had known before, some were new to him, and seeing them in their houses, that then he was seeing them in their cars. So they're losing their home. And he said sometimes they'll check themselves into a hotel on the weekend to take a shower, but you'll see the kid in the back doing school on Zoom in the back of a car. I mean, that just breaks my heart. And so there's a lot of suffering out there, and there just aren't enough programs designed to capture this population that we stigmatize so often. We don't even know they're out there.
You mentioned some of the medications that are needed for opioid addicts to get off the heroin and the oxy. I was struck by something that you wrote, that it takes opioid addicts an average of 8 years and 6 days in rehab to get clean for just 1 year.
Yeah, to achieve sobriety. So people with opioid use disorder, an average of 8 years and 5 to 6 treatment attempts. Those aren't solely rehab stays to get sobriety for just 1 year. So, I mean, a lot of that is, we know that people, especially people with money is not necessarily protective in this environment. A lot of people, you and I probably both know people who remortgage their homes to send their kids to faraway treatment centers in other states, as Tessa's mom did. But when they got there, they weren't allowed to get on the medical regimen that science says is best for the opioid addicted.
Why are they still resisting that? Why is it so hard? Because the science does show that when it comes to withdrawal from opioids and that horrible dope sickness that you describe in your book, and that the title of the book comes from, as you say, in the end, the addicts are just they're not trying to get high. They're just trying to avoid being dope sick. And this medicine can help them avoid that, can help ease them through that. Why are we more restrictly monitoring and inhibiting the release of those drugs? I mean,
than we are the opioids themselves.
Oxycontin was easily and readily dispensed everywhere. Buprenorphine is not.
Yeah. I mean, you kind of have to go back into history to look at it. It goes back to the Nixon era when soldiers were coming back from Vietnam. And methadone clinics were federally regulated. We had a lot of success with that. Actually, if you looked at our drug budget back then during Nixon, we had more of our money went to treatment than went to the war on drugs and incarceration. So we kind of knew how to do it then, which is sort of interesting. But part of the problem, especially in the rehab racket world, is that it grew out of alcohol-based treatment because, still more people are addicted to alcohol than there are to opioids. And the problem is people addicted to opioids tend to die in their teens and 20s, instead of their 50s or 60s like my dad did. But and the idea that abstinence only is really the only model. So when I was following several people in the book and they would go to NA or AA meetings, they were told that they were unclean if they were taking buprenorphine because that wasn't pure abstinence.
How do you think the Trump administration did on this issue?
I think it's been abominable. I think, several years didn't have a drug czar. Then we had Kellyanne Conway in charge. I think he gave a lot of lip service. He said he was going to declare it a national emergency.
He talked about it a lot, actually.
He did.
For the first time, we were hearing from the White House a lot of talk about the addiction crisis in America. The problem is what do they actually do about it?
Right. So and Congress gave some money, several $1 billion. I think it was $6 billion total in the CARES Act funding. And so he didn't get in the way of that. But it was a lot like the response to COVID. There wasn't this kind of, what I wanted to see was, a new deal for the drug addicted. That's what they called it in the 1930s when they really went after it back then, after, heroin had been initially made illegal, or Marshall Plan, whatever. It wasn't even really a national emergency. He only declared a public health emergency, which sounded good, but it did nothing. And his own GAO study said been very, very ineffective. So I'm really hopeful that with the next administration, there will be people, not political appointees, who understand the science of addiction and work to make standard of care in 50 states that is evidence-based.
Right now, we still, as a country, spend far more money on law enforcement, drug prosecutions, interdiction. We heard a lot of talk about building a wall on the border to stop drugs coming in from Mexico. And yet, the story after story of these clinics and these success stories that you write about in your book are all struggling for scraps, for pennies to keep going, to get prescriptions to help these opioid addicts, fight the cravings and the dope sickness and the withdrawal symptoms. These fights, to start programs that would have addicts get treatment instead of go to jail and prison. It's frustrating to see all this money going to one part of the problem, which many argue does absolutely nothing to stop the problem, especially when the biggest drug peddler is an American drug company called Purdue Pharma. Do you think we'll ever get to a point where some of that money can be, when you see the fact and you see the statistics that nearly every person in America, nearly every family in America has been touched by the disease of addiction. A member of our family is addicted. We know somebody, our neighbor is addicted, our schoolmate or teacher, our student, our colleague at work, our coworker, we all know somebody. Mm-hmm. So given the fact that this disease touches so many people, why isn't there more of an uproar, a demand for funding to fight addiction and to fight it and treat it in the way we know based on science works?
Elizabeth Warren was talking about this early on in the campaign. She came up with a plan we need about $100 billion over several years to really make it so that this urgent care for the addicted, whatever version of that, we know what works in certain things, take this from this place and this from this place. And we know we're going to need to put more money to it. And we know that when we do, it's actually better, not just for human beings, but also it's more cost effective than waiting till somebody has endocarditis. And then Medicaid is going to have to pay, $200,000 for a typical endocarditis stay, as opposed to buprenorphine, which costs $2 a day. I mean, it's crazy when you put it like that. And whether or not we'll ever overturn the war on drugs, I'm not sure. During Nixon, we had 30% incarceration versus 70% treatment. That's what we need to get back to. And I'm not saying Nixon didn't invent the war on drugs. So of our drug budget, during Nixon's era, 30% went to incarceration and 70 went to treatment. And it wasn't near as much money as we have now. We've actually flipped that to 70-30 now. And if we could get back toward what we once were doing, I mean, there are a lot of models in the world for that. Switzerland, Portugal decriminalized all drugs.
You just said it. So now 70% of our budget goes to law enforcement and 30% goes to treatment.
Yeah,
it's completely
and it's
flipped.
A lot more money. So we know that when Portugal decriminalized drugs in the early 2000s, they took the money they were spending to incarcerate folks, and they didn't just do away with all the police officers. They had more social workers and more, like they have vans all over the place where you can go and you can get your daily MAT, your methadone, your buprenorphine. And they helped people with housing and other kind of social wraparound services. So they put that money into more of a social work and drug treatment model. And now they have the lowest drug use and drug overdose rate in Europe. So again, there are great models out there, but it's going to take real leadership to start to flip that back again. And you saw in the recent election, Oregon has come out with a decriminalization new law. And it'll be really interesting to see what their results are from that.
Finally, Beth, I'm curious. People really opened up to you for this book. Really profoundly intimate moments of triumph and tragedy. Are you still in touch with all those characters, all those families that you introduced us to in Dopesick? And who of them were you most affected by? I'm curious.
Well, I got really close to the mothers, probably because I'm about their age, and I related to just how hard it is when you have someone in your family with that. And, you know, I had 4 generations of addiction in my own family, and that's all that I know of. It's probably more than that if you went back deep into history. And so the only way I could really see myself writing this book was to focus on the people fighting back. And so one of my favorite people fighting back was Tessa's mom, who just never gave up on her. And she didn't always make the right decision. She looks back now and she says, I should have gone and got her when she checked herself out of that rehab in Nevada. I should have brought her home. Tess had already figured out which methadone clinic she was going to go to when she got back. She just didn't make it in time. And, you know, her mother still wants to figure out how to make this urgent care for the addicted happen here in her community. And she's become quite an activist. And so I got probably the closest to her.
Beth, it was an incredible book. Thank you so much for joining us today. Beth Macy, the book is Dopesick, and it's about to be on Hulu as a television series. Congratulations.
Thank you. I think it's going to be really awesome to bring the stories to a new audience that way.
I hope so. The more we can raise awareness about this disease, the fact that there is help out there, the fact that you're not alone, because that's, you know, the biggest enemy of this. We know that less than 20% of people who need help get it, and even smaller percentage of that get appropriate help, science-based medical help.
Absolutely.
So you've done a lot.
Thank you, Elizabeth, as have you.
Really, really appreciate it. You can find this podcast on Apple Podcasts, Spotify, and on our website at drugfree.org/podcast. As a reminder, if you need help with a loved one who is struggling with substance use, you can text 55753 or visit drugfree.org. Talk to you soon.